Hi, good morning, everyone. So I am Paula Maxwright. I am a general pediatrician at Bluestone Pediatrics. I am parent of Stephen in 6th grade and Charlotte in 4th grade, which is how I've been connected with EMS. Being an outpatient pediatrician, as many of you in the audience probably know, means that I take care of all of kids' medical needs from the day they were born until many of them through college graduation at age 22 or 23. So I get to know kids pretty well, and I see a lot of them. The last year and a half has been really hard for kids. Most kids didn't get COVID. Many kids' families were touched by it in terms of loved ones being ill or even passing away. But all kids were touched by COVID. They lost school time, they lost social time, they lost learning, and this has been hard for everybody. And so as a pediatrician, I have been fortunate to not be as in the thick of things as some of the people that you'll hear from later this morning, because again, most kids have been relatively healthy, but I have seen how COVID has impacted all kids in our community that I am in touch with.
So thank you. Many of us, well, we've all been dealing with masks, and some people are tired and discouraged and maybe wondering if it matters. Could you say anything about advice or encouragement as we try to continue to move on in this school year that we had hoped was going to be more normal, and now it continues to have abnormal aspects?
Absolutely. So the most important thing I can say is that masks work. The reason that we have been able to have school last year and this year and not have COVID everywhere is because you guys have been doing such an amazing job at wearing your masks and keeping your distance and washing your hands. Last year and this year, people in the community, in the school community, have had COVID, but because people have been staying home when they were sick or they were exposed and they've been getting tested and everyone's been wearing masks, as far as I know, we have yet to have a case of COVID that originated from inside school. So everybody who has gotten COVID has gotten it from someplace else. And that is because, again, masks and distancing work, and you guys are doing a really great job. It is frustrating, it's tiresome, it's bothersome. I'm tired of masks too. But the masks are what has enabled all of us to have something resembling as normal a school year as possible right now. So please keep wearing them.
Thank you. That's helpful to hear. Something that I wanted to ask that actually wasn't on the email I sent in preparation, but on behalf of the school leadership, I want to thank you for being part of the school's medical advisory team. Could you just describe what that team was and how you have worked together with Dr. Lehman and Mr. King and Mrs. Archer over the last year and a half now?
Absolutely. So, and I want to say in June or July of 2020, in preparation for hoping to come back to school, Dr. Lehman had emailed me and a bunch of other local medical professionals. There's another pediatrician, an ER doc, the school nurse, some public health nurses, some nurse practitioners, and said, we need help and advice. Can we meet and can we talk? And so we've had, over the course of the last year and a half, several, large Zoom meetings and many, many email and text conversations discussing the best and safest ways to have kids in school and the policies to keep as many people in school as much of the time as possible while still maintaining a safe and healthy learning environment for everybody. So, we've had some big meetings. We've discussed, last winter when we had a couple weeks off before and after winter break for travel. Our team was part of advising for the decision-making process. We don't make any decisions. And for this year, discussing masks, our team had a very long conversation with Dr. Lehman and Mr. King and Ms. Archer and several other people, giving our opinions and advice on mask policy. And every now and then we'll get an email from Dr. Lehman saying, hey, this has come up, or we're thinking about this. What do you guys think about that? And then we all will, email back or call or have a meeting and say, hey, this is what we think about whatever it is that happens to have come up. And one of the things that I've appreciated most about being on this team, this committee, is the fact that your school is thinking about things and trying their best to keep things as normal as possible and make things as safe as possible. EMS is really lucky that it's small, but it's also really lucky that its leadership team is asking for advice and making decisions based on the advice that we give. And I think that those decisions so far have all been really successful, positive decisions that, again, have let everybody have as much normalcy at school as possible, given how abnormal everything has been for the last year and a half.
On a little bit, stepping back outside of our community a bit, just do you have any observations, thoughts about what this going through this experience together might mean, what we might see in the future? And I also think about particularly people who may be in the upper grades in high school and thinking about the future. Maybe they're interested in medical professions or other kinds of roles that might have speak into future pandemics. What do you imagine this might mean for your profession or kids as they grow older?
Well, I don't think that pandemics are going away. This one is will hopefully fade, and things, will get back to whatever normal looks like now at some point. But I think that there's always, for as long as history's been, there's always been another pandemic that was going to come. There was 1918 flu, there was plague, there've always been, there's HIV, there've always been large pandemics of infectious diseases that have caught everybody off guard, and they've affected the world differently at different times, depending upon what the disease was. But I think that this is not the last one we're going to have. It hopefully will be the last one as sort of all encompassing as COVID has been, although I don't know that that's my hope. I don't know that that's what's going to happen. But I think one of the things this has shown us is that in addition to needing, nurses and doctors and respiratory therapists and radiology techs and ultrasound techs and all of the people who make up the medical team who are actively caring for patients, I think there's a really large need for more people in the public health sphere and for research. So even if you're somebody who's like, oh, I can't do blood, I don't want to take care of people, there are lots of things that you can do either as a profession or as a volunteer, something on the side that could impact either this pandemic or future pandemics. You could be a contact tracer for the health department. You could go to grad school and do scientific research on either the viruses or bacteria that cause pandemics, or their treatments, or their vaccines. You could be in the public health sphere and look at health on a population level, and do things like work for the health department. You could get involved in politics and policymaking from that aspect. So there are lots of different ways that if people are interested in sort of COVID and its impacts and changing that, and making changes, there are lots of different ways that people could get involved, again, either as a career or as something that they do on the side as a passion or community service. But you don't have to, either I do snotty noses a lot of the time. You don't have to do snotty noses. You don't have to do blood. You don't have to do ventilators. You can do all kinds of other different things.
That's interesting. Well, as we wrap up here, is there anything else you feel like it'd be important for us to know as a school community as we continue to do this hard thing together?
Um, I think it's important for everybody to know that this hard thing is really hard and that everybody finds it really hard in their own way. Some people have been able to cope with it pretty well. Other people have had a much harder time with it. I know that in my practice, we are seeing many, many more kids with anxiety and depression as a direct result of the pandemic and isolation and not being able to be in school and be with friends as much, as well as the effects that illness has had on their families specifically. And this is a really hard thing. You guys are doing a hard thing. And right now, even if it doesn't feel good, you guys are doing it well. Your school is safe. And you guys have been able to be in school, which is oh so important. Especially last year, comparing the kids that I see, my own kids, and also the kids that I take care of from EMS with the kids that I take care of in the rest of the community who were either in school 2 days a week or were virtual all year last year. You guys are so fortunate to be able to be in school right now, even if some days it doesn't feel like that. But this is hard. And it's okay that it's hard. And if it's overwhelming hard, it's okay to ask your community, your people for help with it. There are lots of kids who, even though everything seems great for them and they don't even know anybody who's ever had COVID, are really floundering right now. And there are lots of ways that we can help them. So continue to do a really good job on this hard thing, because what you guys are doing is working. You're still in school and COVID has not spread through school yet. I hope it won't, but it's still a possibility. But because of all that you guys are doing, it's a lot less likely. But if it feels really hard, it's okay for it to feel really hard, and ask for help if you need it. Because this is something that I think we're going to be hopefully able slowly to pare back all of the things that we're doing. But this is something that we're still going to be looking at and working on for a while to come, I think.
Hello, my name is Davi Moyer-Diener. I'm an emergency physician at Sentara RMH. I work in the emergency department taking care of sick people. Come, follow me.
Here we are in the emergency department. I wanted to take you to an emergency department resuscitation bay where we take care of the critically sick and injured patients. Unfortunately, all of those beds are occupied right now. So here we are in a normal emergency department room. But in these rooms, we are able to care for many, many people. We care for anything from an infant that is several hours old, all the way to an elderly patient who is over 100 years old. Here we can take care of cuts, bruises, minor colds, as well as sick people with heart attacks, strokes, car accidents.
So can you tell me quickly a bit more about COVID-19?
Well, as most people are aware, COVID-19 is a virus. Usually causes some upper respiratory symptoms, sore throat, cough, but sometimes can cause vomiting and diarrhea. The vast majority of people with COVID really don't get that sick. Most people get a minor illness, don't require medical care, but sometimes people get really sick and require IV fluids and further medical care in the hospital, including oxygen and other life-saving drugs.
Can you tell me a little bit more about the people who get really sick?
Yeah, the people that get really sick usually are elderly people or people who have chronic heart or chronic lung conditions or kidney problems. But we've been seeing way too many people who are young and healthy get sick with this. We wouldn't have normally expected that.
And how is this affecting your work in the emergency department?
Oh man, it's creating a logjam or a gridlock in our emergency department. People needing to be admitted to the hospital, but there's not enough beds available in the hospital. People end up waiting in the emergency department for a bed in the hospital. Then people can't come back to be seen, so they wait for hours. It's really sad. It's hard for all of us.
Mm-hmm. And how would you say that this affects the staff and the morale?
Well, everybody gets tired. We're having to care for more people longer. We're sad that we can't take care of people because, They're waiting to be seen, so everybody's just kind of stressed.
And then how about when you think about the broader community? How does it affect the broader community?
Yeah, I mean, the community is affected. Obviously, you know, the tragic deaths of so many people with this illness, but, you know, people delay their medical care. You know, their procedures get canceled because there's not enough beds or not enough staff in the hospital. Sometimes people don't want to see their primary care provider because they're concerned about, you know, getting sick while being out. People are delaying care, and unfortunately, people are getting sick with other things that they shouldn't normally get sick with because they're just not getting care for it.
Mm-hmm. So if you had to give any tips or prevention points, what would you say?
Well, you know, I mean, the data is evolving, you know, so quickly. This is a relatively new illness we haven't been seeing in the past. So as more and more research comes in and people kind of the public health officials kind of understand this better, they come up with new recommendations. You know, I'd say, you know, absolutely you'll have to follow the recommendations of the public health department in terms of masking and distancing, hand washing. But also, you know, get your vaccine as soon as it's available. I mean, as soon as you're eligible for it. Yeah, absolutely.
All right. Well, thank you very much.
Yeah, you're welcome.
Hi, I am Sandra Klein, and I have been an ICU nurse for 25 years.
And I'm Sarah Lichty, and I've been a nurse for 27 years, ICU much of that. Our work has changed dramatically in the last 18 months, and one obvious way is in what we wear for our shifts. We spend the majority of our workday in this garb. Our shifts are generally 12 hours, which really means 13 until we're all wrapped up and ready to go home. Wearing this for extended periods like we do at work makes wearing a mask when we are in public quite easy.
In ICU, we typically see patients get better from pretty critical circumstances. The job normally feels rewarding because we feel that we've helped somebody. That has been dramatically different during COVID, as the survival rate for COVID patients needing ICU care is very low, especially the second time around, as we have made no progress towards any effective treatments for someone needing hospitalization. It's been a hard place to work, both physically and emotionally.
Part of the emotional struggle is watching these patients go through their experience alone. Visitors are not allowed for COVID patients, so we are not only their nurses, but also their sole source of support. Most of our ICU patients are on life support, meaning a breathing machine, along with continuous IV medications and sometimes continuous dialysis. Our job is to work closely as a team of nurses, respiratory therapists, physicians, dietitians, nurse practitioners, and pharmacists to manage their care.
For me, the most frustrating thing is feeling that this second surge of COVID could have been avoided. Our ICU patients have been almost all unvaccinated.
One challenging thing for us this second time is to feel the same degree of empathy for patients, as they generally rejected the recommended preventative measures to avoid infection. However, it's been heartbreaking to watch and have conversations with patients and their families as they struggle and generally feel deep remorse over their decision to decline the vaccine. Some of our empathy is still intact.
We know that school has not been easy for you all in the last year and a half, 2 years, and we would like to thank you for wearing your masks, getting vaccinated as you are able, and doing your part in preventing more admissions that may come to us.
We tend to lose a balanced perspective on COVID. We realize that the majority of people have mild cases and survive COVID, and that what we see day in and day out is not the normal, and for youth, that's especially true.
In many ways, it feels this has been going on for such a long time. It's encouraging to see that the numbers are starting to decrease, but this winter we need to remain vigilant to help prevent another surge. We'll leave you with a few photos from our experience here at the hospital.